So, Miss Irina, it was just a uh, small presentation about our university and about our programs. Now I want to ask you one question about what will be our future plans. Hopefully, this COVID-19 will be normalized soon. And but if it will be not normalized, what we will do for our September and October batch? Because we have so many inquiries every day, so many students to study in our wonderful university, and they want to join there, but they are worried about their future, and they want uh, details that what they will do if not.
All right. Okay. First of all, one more time, I would like to greet everybody who's here with us and participating. Your presentation was very nice.
Thank you so much.
And thank you for that. And especially from the other side, when you're looking, when someone is talking about you, it's really pleasant. So thank you for that. Regarding classes, you know, no one has an answer as of now in the world. So what's happening now, even American universities, you know, here in Georgia, in Europe, of course, everybody is willing to start classes, you know, as they were usually. But at this point, we don't have an answer. My answer would be if borders are not open and if a second phase, you know, we'll have second phase in the world, of course, TMA were ready to have classes online. And I think, you know, more specifically, maybe Dean or Nino Shiukashvili, Miss Nino, would talk about it. But the thing is that I can really reassure you that if not physically, online, will have classes and they will be much more successful even than now, because the whole world, when it happened in March, all universities, we had 1 or 2 weeks, you know, to adjust to this new situation. And you can also talk to our students and probably they can best explain the situation, but I think we're doing pretty well. And even our European partner universities, because as you know, we have a lot of successful universities in partnership with academies, we're working with them, and I have to say we're on the same phase. So at this point, yes, and maybe they will adapt more, Dean or Ms. Nina Shukashvili.
Okay, that's great answer from you. So, is saying that presently we hope that everything will be normal, but we are waiting for, and we will watch what situation will give us, and accordingly we will give the answer. But if everything will be not normal, of course, we will do online classes, and right now TMA is doing the online program in very good way. We are doing it, and our students are pretty much happy about our online program, and also they are enjoying our program at their home, and they are getting their classes as they are in TMA, same environment they are getting online here. So thank you so much, Miss Irina. Our dean is here, Miss Nino.
Yes.
I want to ask you one question about our AMO program, which we have recently added in our program from last 1 or 2 years. And I want to tell you, my viewers, that I had information that some of our students, they have already passed USMLE steps. I have also shared that video that one of our students is recently going to the New York. So can you share with us viewers what is this AMO program and what TMA is doing with this AMO program?
Yes, of course. Thank you for this question, Dr. Bagel. Actually, we've got partnership with many agencies and with many partner universities in Europe and in USA. As far as I could understand, the specific interest of you is USA and USMLE. AMO, what is AMO? AM Opportunities, this is the company, worldwide international company, pretty stable, pretty strong, with a good management system, who is providing us the links with the US hospitals. These hospitals are located throughout the whole country, whole USA. It can be Chicago, it can be in New York or DC, in California even. And what is more interesting, if we are asking about additional clinic, if there is any clinic which is of specific interest of our student or us, they are trying to link us with this specific hospital as well. They can offer the internship there, they can offer the job shadowing there, but this is like the frame, the classic frame of our collaboration. But again, if we need something extra, they're always working and actually offering us to do it. In fact, in the beginning of the February, if I'm correct, I don't remember exactly, but it was like pre-COVID situation.
Yes.
The director of AMO was in Tbilisi, was in our university. He did a presentation, we signed a contract, so he's absolutely ready to provide us with these services and even to widen the list of these services. The main goal of this program is to send our students to USA hospitals, and then they will be assigned to a certain department where they will get the theoretical and mainly clinical practical experience in US hospitals. This is the main.
Very nice. That's very.
But again, if it will be something else we need to do, they're absolutely ready and very flexible and very good management in there. So we can adjust it too.
And also we had inquiry, one question about that we have introduced one digital, or what can I say? We have digital anatomical body in our university now.
Yes. Anatomy Age, it's called. This is kind of newest, the most, I don't know how to express our admiration about this device, because this is big anatomical table with the huge screen of the whole length of the human body. And you've got 4 real human bodies, human bodies information uploaded into this device. And as far as we cannot do cadaver dissections in Georgia due to our legislation, we are replacing it with this AR, and with VR. We've got Anatomy, which has the information about anatomy, histology, pathology, and we've got not only the body parts, but you can also make virtual dissection of this body, go through all tissues, all organs, see anything you need to see, like structurally. Also, there are some cases which should be solved, which are related to these exact bodies, and there are some tests which should be followed to fulfill the course. But except for this, we've got VR laboratory, where this is actually the most favorite room in our of students in our university. They're going there. We've got the schedule. All of them need to get at least 4 hours of VR during the course, during the months of the course of anatomy. They're putting on these eyeglasses, joysticks, and they're going into the human body. I don't know, deconstructing, constructing the bodies and learning anatomy.
That's very good. That's very good. So we are doing our medical education in another level, yes?
Yes, of course. We need this. Without technologies, it will be impossible to achieve our goals now, especially nowadays when we have a lot of issues to solve. Actually, except for devices which are located in TMA, we've got access to online platforms, which is maybe now this is even more important than AnatoMage and the VR room in TMA. We have access to in situ, we have access to emboss. So these are the online platforms which are giving us clinical cases, the MCQ, Q banks, simulations, etc., etc. And we're planning to do even more, but that's plans.
That's very nice.
Dr. Bagel, can I add a couple of sentences? Actually, it's very promising that in the TMA we have the AnatoMage and we have VR, but here we have our first year student who unfortunately not yet, I have not seen yet the TMA. Actually for her and for the students, future students who will join us in September, if we will have online classes, I would add that the option that the case that now they don't have opportunity to be trained and to use all these devices in the next semesters, whenever all the processes will become back to normal, they will have extra classes, they will have additional time to do their job, whatever they had to do. So this does not, the case that now they don't have opportunity to use this AR, AnatoMage and VR, it does not mean that they are skipping this from their program. We just postponed these parts for next semester. So at the end, they definitely will have opportunity to get all these benefits.
Wow, that is very nice. That student will not skip their single point of education during
Nothing,
their
no.
so it is very nice that they will get, if they are missing something during their education due to not present in the university, they will get it in the next semester whenever they will be in Georgia, and they will get live and in the TMA.
Definitely they will get, because we adjusted our educational program according to the needs. Okay, in our educational program, we are talking about first and second semester just now, but we have the clinical level of studying. That's why we adjusted whole our program, remodeled it, and in this semester they are taking theoretical courses, and I would say also communication. They are training in communication skills such as telemedicine, which we think will be very actual in the near future, especially for the ongoing cases, because online consultation with patients, this is also the skill whatever 21st century doctors need. That's why we are adjusting, and we will continue adjusting our program according to the needs. That's why none of the students till the end of their study, they won't skip anything from the program.
That is great. That is great. And also, I want to tell that this program is on recording, and it also, I hope it is also on Facebook. I am not there. We will put all this program on our YouTube and on Facebook later. And for that, Ms. Nino, I want to ask you one familiar question, that you are from with TMA family from last couple of years. I have joined TMA in 2015, and since 2015, I am in with touch with you. So, how is your experience with Indian students in TMA, with Indian students especially?
Thank you a lot for this question. First of all, I want to tell, okay, at the beginning of your speech, you mentioned that they call me mother. They call me mother and sorry, technical.
Hello. Kindly unmute.
Let me write. Okay.
Miss Nino is there.
I think she's experiencing some technical problems. So maybe we could talk about some other issue, and Nina will join us shortly. Ah, she's here.
Sorry, there was some
She's
technical
here.
issue. Sorry
It's
for
okay.
it. Actually, thanks for asking that very important question, because actually Indian students were the very first students who I got during at the start of my medical career, starting my teaching career. And uh, okay, they are brilliant, I would say. The Indian students, I would make a special part for them, because we are from India. The students, whatever we are getting, they are highly motivated. And to be motivated, it is very important in a very difficult study period for doing medicine. They are very smart, because even some teachers, they are mentioning that whenever we have Indian students in a group, just they are grasping the information, whatever we are explaining, and they are very intelligent and very bright-minded. And what another thing I would like to mention, they are very target-oriented. They exactly know what they need, why they want to become a doctor. Because to be a doctor, this is not a job, let's agree. This is style of life. It needs some kind of passion. It needs dedication. It needs a bit different things. And Indian students, according to my not very little experience, I would say, they are gifted with all of this. And sometimes I'm even telling that in my elderly years, whenever I will be old, might be I will come to India to be treated by them, because they are very good students. Or might be in USA, because some of them are already in USA and in UK, and they are already in residency programs there and practicing there. So they are very intelligent, and I'm very proud of them.
That's very nice of you. That's very nice of you. And now I want to ask one question too from our international department, Miss Anna. Miss Anna is here.
Yes, I'm here.
Yeah. Miss Anna, I want to ask you one question. How many students we have here in TMA right now?
Right
Do you have some
now,
idea?
we have approximately 770 students.
700. So viewers, you can see how many Indian students we have in TMA and how much interested they are in TMA. So all
Yeah,
Vidana,
at this moment, we have approximately 450 Indian students. And other parts of students are Georgians and students from different countries, from USA, from Canada, from Germany, from Israel, from Nepal, and other countries. Yeah, maybe I have already answered your question, yes?
we have how many active students we have right now in TMA?
Yeah, I have already mentioned that right now we have 1,770 students, active students.
1770 students, near about 2000 students.
800
Yeah,
students.
800 too, yeah.
Up to 800.
So we have international students mostly from all around the Europe. Uh, Miss Anna already told we have students from America, from Canada, even from UK, Germany, from UAE, from all around we have international students, and that's why it is the international university. And
Yes, we are.
one more thing that there is so many other schools in the medical schools in the Tbilisi or in the Georgia, but TMA is exclusively medical university, or we can tell TMA is the exclusively medical schools. We have
Yes.
other schools in Tbilisi, but they are also taking part in other courses. But TMA is conscious only about the medical student. So this is one of the big adventure here, that we are only medical and we are focusing 100% and we are giving our energy 100% to the medical students only here. And that's why I'm very, I can say very proudly that we are giving very good result in the Medical Council of India examinations that were held in last couple of years or last couple of the months. TMA is giving very good results in the Medical Council of India. Even without getting Medical Council of India coaching, we are giving very good result in the MCI. Yes, I am right, Miss Nino?
Yes, I will add because this is one of my favorite topic. Actually, 2 years ago, we got our first international Indian graduates, and we were very keen and we were looking very forward for their results because whatever we are doing, it will be proved and it will be strengthened by MCI results. Actually, probably most of you know what are the passing rate of MCI, but we have anyway calculated because I was very interested about these statistics, and we have calculated the passing rate for 2018 of MCI. It was 17.4% of overall passing rate from all the countries, all the applicants, and from TMA it was 78% passing rate. So it was, you know, whenever we were getting this course, we were so excited in TMA. And also I want to add that they are not only passing, but we have students who are passing with a very high scores. And according to calculations, actually, some of our students are even top 0.1% of passing rate. So they
Wow.
have the highest scores in last year, with last batch, whatever, in 2019 we had, they were in 0.1% highest score of the students. So that's why I mentioned our students are very motivated and very intelligent.
That's very
And
nice.
we are doing our best to keep that motivation for them and move it forward and
That's
make
very,
good doctors for them.
that's very nice. That's very nice. So, uh, I think we are covered a good amount of the questions that were important questions in this webinar. And I want to thank all of my participants, especially first of all, our rector, Irina Shutaze, and our
Thank you.
finance department head, Ms. Nino Shukashwari, our dean of the school, and our international department, from our international department, Ms. Anna, and all
Thank
of
you.
kids from Gujarat, from Hyderabad, from Kerala, and from Rajasthan, from Madhya Pradesh, from all around the India, and students who are here. I'm very thankful for them, and hopefully everyone liked this webinar. And it was my first experience to do this. We are doing these webinars in India, but it was my first experience to do in for TMA staff. And I hope everyone enjoyed this webinar. And if we will get any chance, or if we will get any requirement more in the future, I want to tell my associates we are ready to do these webinars in future also with our staff. And now I think everyone is familiar with each other. Ms. Nino will join, or Dean will be join, or anyone as per requirement. We will join these webinars and we will explore our TMA to all over India during this tough time that we are passing away, and we will try to give more and more information, and we will try to help each and every medical student who are already our students in TMA and who wish to get admission in TMA in future. So we are ready to help 24/7 to all of these students. And again, I want to thank TMA that you have introduced our online program on very on time. You have presented this online program in March, 16 of the March. We have started, and I am thankful to you from all of my Indian students, from all of our Indian associates. I am very thankful to the rector of the university that she is very active to type of the activities, and she has started without any hesitation and without any problematic. She has started this program, and I am very thankful to Miss Irina.
Thank you. Thank you very much. Thanks for participating.
And so I hope we should now end this session, and everyone, you should stay at home, take care of your families, your friends, and enjoy